Welcome to episode 191 of the Daniel Yoris podcast with today's guest, Rick Olderman. Let's go. Welcome back to the podcast, everybody. Joined here once again by Rick Olderman. Rick, thanks for being back on the show. I appreciate you.
Thanks for having me, Daniel. It's great to see you.
We had a really good chat last time, and so I'm excited to speak with you this time because people are always getting injured, and I've picked up a couple of injuries myself since the last time that we talked, as I always seem to be. But it's an ongoing issue that, we're all dealing with, and yourself right now included as well.
Exactly. Yeah, I'm recovering from shoulder surgery from 3 weeks ago. So happens to the best of us, I guess.
This is true. Now, without giving a big background, because people can go back and listen to the episode that we did before, talk about anything that is new in your lens of looking at injuries, especially in light of this most recent injury that you're experiencing yourself. I know that we were just talking before that you tried to rehab it a little bit on your own, ended up deciding that you needed surgery. Talk a little bit about your experience with this most current injury.
Yeah, well, I was doing some trail running and running downhill and, tripped, fell on some rocks and knew instantly, because it was a level of pain that I hadn't experienced normally when I run trails. And I knew something was wrong, completed the run and just tried to rehab it for the next month or two, and it just wasn't quite right. There were new things happening with the shoulder, like clicking, pain in areas that I didn't normally have pain. So I did my best to rehab it, and finally went to an orthopedic surgeon who determined that I have a labral tear and tore my biceps tendon.
So given the idea that all injuries stem or are related to one another, going back from our last conversation about think about all the past injuries that you've had. Mm-hmm. Is there anything that you've had in your shoulder that led to it? Because there is an element of freak accidents like what happened to you. This isn't an overuse injury or something like that. You're running, you slipped, you fell. You could have had the best shoulder ever, but a fall in a certain way could lead to injury. So do you think there's any linking there, or how have you changed that idea in your head at all?
No, I think the link is actually in my legs, not in my
Interesting.
arm.
Okay.
So chronically, whenever I would get fatigued on my runs, my left foot would always start dragging first. That, if I was going to trip, that would always be the foot that catches the rock. And so I always tried to pay particular attention to my left leg as I'm finishing longer runs.
Right.
And I didn't pay attention enough on this particular run. And so that was exactly the foot that tripped on the rock. And so that's what led to the fall.
Makes sense. Now, I guess related to this, because it's a fall, something that you're going to talk about, or you have talked about in your upcoming book, is the idea of reflexes, and how, I'm not sure how exactly you're going to talk about it if I haven't read the book yet. But in something like a fall, there's a reflex to catch yourself. Mm-hmm. And so that can also lead to the injury, but protect against something else, where, your arm outstretches to save your face from being smashed, or from your ribs, or from something more important than your arm or your shoulder. Mm-hmm. So how do you think about that, and how do you prepare yourself to be able to handle these quote unquote catastrophic random accidents, and prepare your body the best for them?
Yeah, well, fortunately, I've had lots of practice falling while running. So, I have become quite good at it, but this was a steep grade, and it's very difficult to fall downhill and catch yourself. So, so there wasn't much. The only nice thing is, the reflex that kicked in this particular case was called a startle reflex, and that immediately caused my upper body flexors to bend immediately. So I landed on my right hand first, and then that threw me onto my left shoulder, where there happened to be a rock. And so that's what led to it. But the reflex patterns that I'm talking about in the book, startle reflex is one of them. But these relate more towards a different type of reflex than we're normally used to thinking about. Like, for instance, in this case, I fell, we protect ourselves immediately, things like that. But the reflexes that I'm referring to in my book are deeper reflexes that have larger patterns of movement associated with them, when we think of reflexes, typically we think of that knee-jerk reflex when you go to a doctor's office and they tap your knee and your foot kicks up. That's a simple reflex. However, while we are developing neurologically in the womb, we have embedded deeper reflexes that involve patterns of movement. The startle reflex being one of them, and that reflex pattern is, the upper body flexors flex, our shoulders shrug up. We basically kind of fold in on ourselves to protect, what you were saying, organs, face, things like that. So so those are the reflexes I'm referring to in the book, rather than those more simpler reflexes that we're probably used to thinking about.
Got it. And then, so can you then explain how the fascia relates to this? Because I think something that maybe people have heard of before is like some variation of, the body is all connected through fascia, and your head is connected to your pinky toe, and that can sometimes sound very, a little bit woo-woo, a little bit out there, and it's big words that don't mean a whole lot to someone who doesn't know what they're listening to. And there's probably some like pseudoscience and over-exaggeration of that, but there's also, there's a lot of truth and evidence to this. And so how do we meet in the middle, and can you describe what that is and how people can pay attention to this or use this to prevent injuries going forward?
Yeah, well, you're diving right into the heart of the matter, Daniel. So basically, and I explained this in my book too, there's a great book written by Thomas Myers called Anatomy Trains. And he discovered that we have superhighways of fascia running through our bodies. Now, fascia is connective tissue. And in anatomy labs, in most medical schools, what we do is we typically kind of try and push all the fascia away so we can get to the good stuff, which is the muscle, the nerves, the blood vessels, and so forth. And so, but Thomas Myers is a fascial expert, and so his focus is the fascia. And so he identified that there are superhighways of fascia running through our bodies that run from our head to our toe. In fact, these lines of fascia can be dissected from the body as one contiguous unit. So it's not like a little piece here and a little thing there. It connects all muscles, tendons, and ligaments from head to toe. So it's all can be thought of as one unit. And these superhighways occur in different planes of motion in our body. There's one along our back, there's a couple on our front, there's one along our side, and then there's a spiraling fascia that runs through our body for rotational movements. And so the reflexes are based on a little structure called muscle spindle. And muscle spindles are embedded in muscles, but also embedded in muscles is fascia. And so it's been found that fascia is continuous with the outside coating of the muscle spindle fiber itself. So muscle spindles not only, and muscle spindles work, for instance, that's the thing that we were just talking about with our knee jerk reflex. It protects the muscle from excessive or rapid lengthening or changes in velocity of lengthening. And so when you tap that knee with a hammer, what you're doing is giving a rapid increase to the tension to that knee tendon, which then causes the muscle to reflexively contract to protect that muscle attached to that tendon. And so reflexes occur all over the body. That's just the simplest one that we have, the most prevalent one that's tested. So the connection between fascia and these reflexes is the fact that muscle spindles are mechanoreceptors, and they are embedded throughout our body. And fascia is contiguous with these mechanoreceptors too. So whatever a spindle reflex is occurring, fascia is involved because it's also attached to the fascia, but also the fascia is deeply embedded at very deep levels in muscles. So you can't have movement or a reflexive action occur without also including fascial response as well. Does that answer your question?
Yes, I think so. The fascia itself it does not contract, or it will expand and be pulled, but it doesn't create movement. Is that correct to say?
It does contract.
Or is that incomplete?
Yeah, it has contractile properties. And there's and in my book, I highlight a particular type of fascia called myofibroblasts, which are laid down in areas of the body that are mechanically strained. And myofibroblasts have up to 6 times the contractile capacity of normal fascia. Because when you go to a massage therapist and they're saying I'm massaging out your fascia, it's because that fascia has contracted to some
Right.
extent, right? So fascia has that ability to contract or shorten. Myofibroblasts is a more active form of this. Now, the interesting thing about myofibroblasts is that they do not contract based on a neural input. They contract, our muscles contract based on a neural input. Our brain says, bend my elbow, and your muscle contracts to bend that. Myofibroblasts contract based on chemical input. And in particular, there's a hormone-like molecule called a cytokine that is released when we are in times of stress. And so that cytokine circulates through our bloodstream. And the particular cytokine I'm referring to is called transforming growth factor beta 1. And so what that does is that triggers the myofibroblasts to contract. Well, the myofibroblast contraction is a slower, more like a background contraction that it's sustained much longer because these chemicals are circulating in our system longer. It's sustained longer than a neurally contracted muscle. So we can say, okay, biceps now turn off. You can let my elbow straighten again. But the myofibroblasts involved in that muscle may not fully allow that muscle to completely relax because the myofibroblasts are contracting as well. And only when those cytokine levels lower will that happen. So this can explain why we can have chronic back pain in muscles that are relaxed, because we have and I'll back up a little bit. There's an area of fascia called the thoracolumbar fascia that is located in our low back area, and it's particularly rife with myofibroblasts. And so that area of our body is prone to prolonged contraction of muscle and fascia, even when our neural messages to those muscles are telling us to turn those off. Does that make sense?
Yes, it makes sense to me, but I think that like we need to maybe dumb that down a little bit, and I don't mean dumb in a negative way, but but for people listening, like that's a lot of stuff there. So tell me if this is correct and in a way to connect this. Everything that you just said explains to me two things. One is why muscles feel spasmy or tight once they're injured or an area is, even though it might feel loose, there's something that constant contraction that is squeezing it to keep it protected. And then two, why movement after an injury is so helpful. And one being to loosen that part and move that fascia, but then two, to direct that fascia to heal along the proper lines versus being thrown all over the place. Do those things make sense, or are they correct at all?
Yeah, they are correct. And so I'm glad you brought up movement, because this is the third braid of our pain cord, basically. There's movement, there's fascia, and there's reflex patterns. And these are the three things I go into in the first part of my book, where I explain Dr. Shirley Sahrmann, who was a researcher out of Washington University in St. Louis and wrote a couple textbooks, has won every physical therapy award possible, and is just one of the most brilliant people I've ever met. But she identified 3 movement patterns that cause most back pain. And one is an extension problem where we're arching our back too much. One is a flexion problem where our low back is flexed or flattened too much. And the third is a rotation problem where our spine is rotated. And these are chronic conditions. So her whole thing is, the way we're moving is causing these 3 patterns to occur. For instance, if you lock your spine in extension just to bend over to pick up a sock off the floor, well, that's excessive extension of your spine. You don't need to lock your back into, if you were lifting 100 pounds off the floor, yes. But people have adopted these postural strategies to do their activities that throw them into the extension, flexion, or rotation camp. Okay, so this is the really interesting thing. The 3 movement patterns, extension, flexion, and rotation that she identified, are also fascially represented in our body by these superhighways. There's an extension line, there's a flexion line, and then there's a lateral and rotational line. And these deeper reflexes that we talked about in the beginning that involve larger patterns of movement also follow these same three patterns: extension, flexion, and rotation, and side bending. And so this is what I highlight in the book. And I believe this is what we've been missing in medicine, is a larger understanding of how these three: movement, fascia, and these deeper reflex patterns fit together to cause chronic back pain. And you're absolutely right. Movement will help loosen the fascia unless you're moving in the same way all the time, which then causes the fascia to be chronically contracted or shortened in those movement patterns. Same with the muscles.
Right.
All of this is reinforced by these reflexive patterns as well.
Right. So then it's about moving correctly, and I think this is important to highlight.
Yes.
It's not about stopping or preventing movement or avoiding certain planes of motion or types of exercise or something like that. It's just about giving your body enough of what it needs and not too much of what it doesn't need, right? Like you said, bending down to pick up a sock, you can let your spine bend and move because it does do that. You don't need to be so rigid all the time, but you shouldn't bend down and pick up 500 pounds with a bent over spine if your body's not conditioned to do that. And so that's probably where more of the injury comes in, is where, like, the way I was taught the phrase is something like when the input basically supersedes the ability of the joint to handle that stress. So if your body's not able to handle that 500 pounds with a bent spine, injury will occur. But if you've conditioned yourself to do that over months and years, then theoretically you should be fine to be able to do that.
Theoretically. But so this brings up another point. How do you know if you're moving correctly or not? And so our movement patterns are based on what we've done in the past. A part of our brain called the cerebellum is what houses our habitual movement patterns. And so the brain is really good at helping you get from A to B, right? Oh, I need to walk across that room. I'm going to get there. I'm going to be successful. I need to lift that 500 pounds. I'm going to do it. I'm going to be successful. The brain isn't as concerned with how you're getting from A to B. Your brain is concerned with more of a short-term outcome rather than the long-term outcome of what you're trying to do physiologically. Does that make sense?
Yeah, makes sense.
So
to me. The way that I was taught this was like, if you have EMGs on someone's body and you ask them to do a squat, you will never get two exact same readings, because the body, like you said, is not interested in doing an exact movement. It's interested in getting you like down and up or doing whatever the thing is that you're doing. So the result will be the same visually from the outside, but internally it's not always the same.
Right, but this is the point of practice. So practice ingrains movement patterns, right? We practice in sports so that we can become more efficient in how we're achieving some movement or behavior, cycling, swimming, whatever, right? Throwing a ball. So it also works for things that aren't involved with sports. So every time you bend down to pick up that sock and you're using excessive lumbar extension to do it, you're retraining and reinforcing that neural pathway and that neural pattern of usage in your body. Your brain doesn't know that is corrosive to your body over time. It just knows that this is an efficient way to do it. I'm getting from A to B, and this is how I've chosen to do it. This is how I've always done it. This is how I will continue to do it until something happens. And so because our bodies are really great at healing, and it will heal all of these minor aches and pains and problems and so forth, So for the most part, all of these faulty movement patterns are flying under the radar because our body is able to heal and catch up. But 20, 30, 40 years down the line of doing these habitual movement patterns that have slowly degraded your body, there comes a point where there's a straw that breaks the camel's back. And usually it's picking up that sock for the 300th time, right? And then we have back pain, it doesn't go away, and then we get an X-ray or MRI. Oh, well, you've got disc bulges and disc herniations, or you've got stenosis, or ligament tears, or whatever. And those things didn't occur from you just picking up that sock that last time when you felt the pain, those have been accumulating over time because of the faulty movement patterns over decades.
Right.
And so this is why I have a little exercise in the book where I have you, if you could do this too, Daniel, if you clasp your fingers, go ahead and clasp your fingers together like this. And now look down and see which thumb and finger is on top. Which one is it for you?
Right hand.
Okay, now without looking at your hands, unclasp them and reclasp them with the opposite fingers and thumb on top. All right, and if you just keep that there, and if you have done this at home, you'll feel that this feels kind of weird.
Yeah.
Right? It feels different. Even though it's an innocuous thing, we're just clasping our fingers together. But your brain is now sensing that some change has happened in how you habitually do this behavior. And after some period of time, your brain's going to get pretty annoyed. And it's going to tap into an emotional component that says, this is kind of making me irritated and upset. This must be wrong. But your brain doesn't know whether this is really a wrong thing. It's just basing that emotional response on the fact that you've done something different. And so this goes to our sock pattern, because if you change how you suddenly pick up that sock, you're going to get all these alerts from your brain that say, oh, whoa, 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 whoa. This isn't how we do things. This can't be right. It feels different and wrong. But in fixing chronic pain, you often have to do things that feel different and wrong, because the thing that feels the same and right is what is actually causing your pain. And they fall into these three patterns: extension, flexion, and rotation patterns that are reflected in both movement research, fascial research, and neurological reflexive research.
That makes an absolute ton of sense. I mean, we see this in training, and I'm sure you see this with patients like all the time, when it's like, hey, I want you to do this exercise, a squat, a bench press, a whatever. And okay, do it a little bit different. And it's like, oh, that feels weird. But it looks to the practitioner, to me, like it looks right. Like that's how it should look. And the way that they were doing it before felt normal, but it was like weak and off balance, and it looked very strange. But that's how their body did it. And I know based on experience that like, hey, if you do that right now, it feels good because we're doing it with 10 pounds. But try that with 100 pounds, and that's not going to feel so good. And / you won't be able to do it. Right. So let's do it this way, which is going to feel awkward in this moment and right now, but give it a couple weeks and this is going to feel normal for you. And even simpler analogy of that is anyone who's had an injury to like your hand or arm, and I'm not sure how your shoulder's been, but like I broke my collarbone a number of years ago when I was a kid, and it was the right side. And so for a couple weeks I was, in a sling with my right arm, and I had to do a lot of stuff, eating and brushing my teeth and all that stuff with my left hand. I'm right-handed. And at first it was very, very weird, and it was very awkward, and I wasn't very efficient at, being able to, hit my mouth with the toothbrush and all that kind of stuff. But then eventually you kind of just like figure it out. And my left hand wasn't as good as my right hand, but compared to day one, on week 4, it was way better because you just learn that pattern. But I guess the tough part here is, how do people go about figuring out what I'm doing is wrong until there's an injury?
Yeah. So this is why I love my recent book so much. So the first section is devoted to what you and I have been talking about. And folks, don't get scared by this sounds too complicated and all that kind of stuff. I'm just kind of laying out the science and how our body is built. And at the end of each chapter, I have like easy 4 take-home points that involve none of the big words that I've used. It's just, this is basically how your body's working. All right. So the second section is figuring out where you're going wrong. So the first 2 chapters of the second section are to test, well, do I have an extension problem? Do I have a flexion problem? And then the second chapter in the second section is, do I have a side bending problem? How do I test that? So the knowledge of whether this is happening in you is first and foremost, you have to understand the pattern that your body is in. And then the rest of the chapters are devoted to figuring out why you're in those patterns and how to fix those problems. And they are often problems further away from where you're used to looking for your pain. So that's how you do it, basically.
Right. That makes sense. I think even a pretty recent It sounds weird to me to say that this is like a trend. And I don't know if you've seen this in your circles or online or whatever, but like running seems to be very trendy over the past like 6 months to a year, even though it's like, pretty basic old form of exercise, but a lot of people have taken up running recently. And I think people don't realize how injurious, if that's a word, running can be. And I think it's a good example of all the things that you've been mentioning. You have a slightly improper movement pattern based on no fault of your own, just how your body is moving. And then you go for a run, and that's several thousand steps, which can be equated to like several thousand reps. And then do that over weeks and months, and you realize like, oh yeah, my back is killing me every time I run. And well, why is that? Because something is wrong with something in the way that you're moving, and it may be your back, and it may be your ankle, and it may be your knee, but it's not paying attention to how you're moving that's leading to these things, which is less obvious than, you went to do a deadlift that was a little bit too heavy and you hurt your back. That's a very easy connection to make in your brain, although it still may be because of something that's not in your back, right?
Yes. So two things about that. One, I tell actually a story of an elite marathon runner that I was working with who had chronic sciatic pain on one side of her body. She had a whole medical team and trainers and so forth. And within 5 minutes, we realized that that's not where the problem was. It was on the left side of her body. And she was compensating to her right side to offload the problem on her left side. Well, no one had even looked at her left side before, which ended up, to her astonishment, was 50% weaker than her right side. Even though she had all of these big, huge team, no one had ever bothered or knew to test that kind of thing. And these are the kinds of things that we test in my book to figure out which side of your body is having the problem that you're compensating for is a big first step to understanding why you're having pain. This is especially true if you have unilateral pain like sciatic pain in one leg or SI joint pain or one-sided back pain. Usually there's an asymmetry to how you're using your body. And most people assume that the problem is the painful side, when often the case is that the painful side is compensating for the non-painful side. And so, which was the case with her. The second point I'd like to make with that is most runners that I treat, the problem that is leading to their running pain is found in their walking pattern. Their walking pattern is setting them up for poor running dynamics. So running, it's hard, for instance, a lot of people with chronic hip, knee, back, whatever pain, their butt muscles aren't working very well. But it's hard to run without your butt muscles turning on because your knees bent, you're landing on that leg. So certainly the butt is firing. So why would the butt be weak? Well, it's not because of the running pattern. It's because of how you've been walking, because we spend maybe, 1 or 2% of our time running versus 98% of our time walking.
Very good.
And so fix the walking to turn on. And if we take 10,000 steps a day, that's 10,000 repetitions of gluteal activation that then sets us up for success for running.
It makes a ton of sense. I know, just to add on to both those things that you said, anecdotally for me, every single time that I've been injured where something that's like on one side of my body, it is almost always followed by an injury on the other side of the body. Within a couple months or something, something else is coming because of the compensatory factor there. And two, I love that you mentioned how the running injuries come from walking, because we're spending so much more time doing it. I think that more people get injured doing like seemingly innocuous tasks, like picking up the sock, like walking, like doing something that's not very intense, and then you blame it on, oh, I've been running a lot, or I've been deadlifting a lot, or I've been doing whatever. It's like, well, but you've also been walking a lot, you've also been sitting a lot, like you've also been sleeping in a weird position a lot. Like those things are way more than the very small relatively amount of time that we're exercising.
Yeah. What's the one thing that almost all doctors, physical therapists, or chiropractors will tell you that you need to do more of? Go walk. You need to walk more to get more exercise. Well, what if you're walking incorrectly? Then you're only deepening the problems. And this is what often is the case with chronic problems.
So are there any general things that you can give people here without going into so much detail that's, of course, laid out in the book about how they can think about their walking and look for things that they can try to improve? Because it's pretty hard to walk and think about squeezing your butt every step. Like you can do it for a bit, but.
And I'm glad you brought it up like that, because walking correctly doesn't involve you consciously squeezing your butt at all. Walking correctly means that your body's working the way it should be without you even thinking about it. So the answer to walking correctly will not involve you, pinching your butt cheeks together. Because if you see something that's interesting or a car's coming your way, then your butt turns off. Well, then you haven't really learned anything.
Right.
So the key to walking correctly, in a nutshell, is that when the foot is advancing forward, your whole body should be advancing with that foot. Most people advance the foot forward with their body staying behind the foot. When that happens, the knee then locks, that turns off the gluteal muscles, the butt muscles. And so if your body advances with the foot, then your knee will automatically soften when you land, and the butt will automatically turn on all by itself. But this is very difficult for people to do. And there are reasons why we learn to walk incorrectly, I think largely based on our shoe wear. But
I'm so happy you said that.
yeah, because a thicker sole on our tennis shoe allows us to throw that foot out in front of us and slam that heel down. When we do that, it locks the knee, turning off the gluteal muscles. And now the gluteal muscles are some of the strongest muscles in our body. They are designed to control the whole pelvic and whole lumbo-pelvic system. And if they're turned off when we're weight bearing on that system, that is when all breakdown ensues.
Yeah. So this is something I've been banging this drum for forever. And once I finally realized that I went way too far, I read the book Born to Run. I forget the name of the author, but it's one of the books that started
Chris
the whole
McDougall.
There you go. Started the whole barefoot thing and really popularized it a lot. And I was like, oh, this is the answer. I started running on the treadmill barefoot for, a long time. And sure enough, stress fracture in my foot a couple weeks later, but that was like, a long time ago. It was a long time ago now. But figuring out that your foot is supposed to work properly, that you do actually move differently when you're not wearing shoes, whether you're running or walking, because of the cushioning on that shoe. And then you don't need to be a biomechanics major to figure out how that would affect things up the chain, right? Like you said, the knee locks, the glutes turn off, and your leg just kind of swings through, but you're just smashing on your ankle, or on your heel rather, like all the time, times 10,000 steps a day, and times even more and more intensely when you're running. And so it's not that much of a leap to understand why that's a bit of a problem.
Yeah, I in the book I have a quick little test. I mean, if you think you're walking perfectly and your shoes have nothing to do with your walking, walk a block with your tennis shoes on, and then walk a block without your shoes on, and you'll for sure notice a difference in how you're walking.
Yeah,
you can't get away with walking like that without your shoes on.
Exactly. Now, one thing with the locomotion, do you know who David Weck is? Are you familiar with him at all? He's the guy that invented the Bosu ball, actually. So for all jokes with the Bosu ball, he's also come up with this theory of like the spinal engine and this coiling core theory, which sounds very similar to me, from my understanding of it, to what you're talking about, where when the foot moves forward, the body follows it. And so our spine doesn't like rotate. We're not like spinning as we walk, but like the hips will rotate, and kind of the glute, pulls and twists us back into position. Does that make sense? And I'm probably doing a horrible job of explaining this, but essentially we twist as we walk, and we do rotate. And if you watch a high-level sprinter sprint, like their body does rotate, and the spine kind of moves and flexes with it, along with the hips and the glutes. And so having that greater action and those hips involved is going to, like, that's more of the correct way to locomote, to move, rather than being stiff as a board and walk in a straight line like a soldier, right?
Correct. But hearing that, what people might say is, oh, I'm just going to start rotating more when I walk. Well, if you have a rotated spine, that's going to work well for half of your steps, because you're walking into that rotation, and it's easy. But the other half of your steps, you'll be walking against that rotation. And so that recommendation would be painful and pain producing. So I have found, yes, of course, there's some rotation with our walking. But what I have found is that when people walk with their foot coming in front of landing in front of their body like that, certain hip muscles start to become tight, and the pelvis doesn't know how to do the subtle rotation that occurs during walking. And so as you start walking, allowing your body to advance with the foot as it comes forward, you will realize that I can't do this. And it's because your pelvis and hip muscles are not used to the length and firing that's necessary to do this. So I always just tell people, look, just take little Tim Conway steps, just take, a 2 or 3 inch step instead of your usual 1 foot or 1.5 foot step, and start small. And within a day or two, your pelvis will learn how to walk correctly like this. But it's like that, you brought up that example of that guy lifting 100 pounds or 500 pounds off the floor. Well, you wouldn't change someone's form and then give them 500 pounds to lift immediately.
Right.
You would give them maybe 50 pounds, and hey, let's try and see what this form feels like with a lot lighter weight, so your body can get used to it. Same with changing your gait pattern. You don't start off with big long strides like that right off the bat. You have to start off with smaller strides to teach your body how to do that.
So as part of this moving forward with your body, also keeping like your center of mass over your foot rather than further behind it where you're reaching out forward. Does that
Correct?
That makes sense, right?
Your center of mass is coming forward with the advancing foot.
And
so what a lot of people end up doing is they end up bending forward from their hips. Oh, they want me to walk like, no, I'm not asking you to bend forward. You're still staying upright. You're just letting your body come forward. And if this is perplexing for you to try and figure out, almost guaranteed you've been walking incorrectly.
And so bringing your hips forward and keeping your center of mass forward, it directs the force like more up and down versus like the ground reaction force more in line with your body rather than kind of like working against you in opposition.
Well, what it does is, because the knee is able to be slightly flexed at foot strike, it disperses the forces all the way up through the whole system rather than being absorbed by one joint. Because if your knee is locked and your heel is landing, the only joint that's really accepting that load then is your hip joint. If you walk correctly with your entire body advancing with your foot, then all the joints in your whole body are absorbing that force. And the gluteal muscle, again, the largest or strongest muscle in our body, has a chance to control the thigh bone rotation. It can hold you up. It can control the pelvic orientation, whether it's rotating, whether it's side bending, all sorts of things. So it gives your body a chance to disperse things throughout the body rather than just landing on one or two joints.
Makes perfect sense. I mean, like a elementary school level of like bridge building would be like, put the load bearing across multiple pillars or whatever, rather than just like all on one thing. Right? We've got a lot of things in our body to create support and strength and stability. Use them rather than just relying on one.
Yeah, exactly.
Something I wanted to talk about, and slightly switching gears, but on the same topic. How does our own psychology and maybe stress from regular life or greater traumas for bad things that happen to us, how does that play into all of these injury things? Because I think we can anecdotally see that when people are in times of stress, they're more likely to get injured, more likely to experience pain, even if there was no injury event. How are these things related?
Yeah, so I bring this up in the book too, because this goes back to that myofibroblast idea, that we have a type of fascia that's laid down in mechanically stressed areas of the body. The low back and lumbar spine is one of those areas because it represents a significant change in curve in our spine, because as our low back curves, our sacrum then comes and it curves the opposite direction. And then we also have a pelvic structure that, relative to our lumbar vertebrae, it's unmoving. So we have a movable, thing like our spine against an immovable object. Well, the junction of those two areas is where you're going to have the most mechanical stress. And it is also a direction and curve change. So just by the architecture of our body, myofibroblasts will be laid down in the low back and upper pelvic regions for this reason, to help support this mechanical strained area. We've also learned that myofibroblasts are triggered by cytokines, which are released during times of stress. So this goes to your question. If you're constantly stressed, then you constantly have a small degree of cytokines activating those myofibroblasts, contracting that area of your body. Also, those myofibroblasts have high, roughly in the thoracolumbar fascia area, I think 40% are invested with sympathetic nerve fibers. So now there are also pain receptors in that area too. So it's activated, it's contracted for prolonged periods of time, regardless of whether your brain is telling those muscles to turn on or off. And if you live in a chronic, if you have trauma, if you live in chronic stress, if you have PTSD, then you are prone to that area being activated more often. And I believe this is why when I remember I was working on with a woman with chronic back pain, and I was working on her inner thigh muscles, and a memory of her father leaving her came up when I was working on her inner thigh muscles. Well, the inner thigh muscles are part of it's a deep fascial line, but also this is where I believe her trauma was lodged, because it was a mechanically stressed area of her body where more myofibroblasts were already. And then she had this traumatic exposure that lasted for a prolonged period of time, that it became lodged in her inner thighs. And this is why a lot of massage therapists will say, oh, this emotional event happened with my patient when I was doing this massage to this area of the body. I believe this is how and why that's happening.
That's extremely interesting, because I think a lot of Eastern wisdom or ancient medicine wisdom refers to this like various levels of trauma and pain and things being stored in certain parts of the body. And then when we look at that through like a Western evidence-based scientific lens, it's like, that's not like, it's just hocus pocus. Doesn't really make sense. But to me, it's always a challenge, because like we know this to be true, we just can't prove it. And so how do we really get there? And this is probably closing that gap of what that might be.
I think so. I can't think of, I think it would be an interesting, I don't know how you can prove that, through a research study, other than maybe having sensors in someone's thoracolumbar fascia with, myofibroblast concentrations, and then traumatizing them in some way.
Which would be horrible and unethical.
A level of contraction, right?
Yeah.
I don't know how else to prove this. And this is a thing I bring up in my book, is that in medicine, we have a lot of smart people in medicine, a lot smarter than me, but and who are focused on research, but we have all of these pixels of research floating around out there, but no one's bringing them back into a cohesive idea of how our body works.
Right.
And so it's very easy for researchers to cherry pick whatever research they want to use to support their belief systems, right? You can find some research that'll prove everything, no matter what you believe, right? And so this is the hard thing, is that it's left up to the practitioner to put this information together, but our practitioners have biases about what should be working. Some practitioners are heavily manual therapy based, so everything that solves someone will, be using their hands. And so that's the kind of research they're going to look for, is the research that supports using my hands to solve a problem. Doctors will look for research that, this surgical technique or this injection site, is what will solve the problem. And that's why I'm so excited about this book, because I feel like I've brought together at least 3 areas of research to create a model, to show a model of how our body is actually built and integrated that is causing us to have chronic pain. And I don't think anyone's done that before.
It's a very difficult thing to do. And as we get more knowledge and science, like no one can keep all of the things in their head and know every detail of every study and all the biases and all the things that have ever been done. And maybe AI will help with this. And eventually, as things get more amalgamated, it will be able to keep more ideas in its head and recall more facts and things and make connections that we didn't previously realize. But that's probably a little bit into the future, maybe not that far away. But one thing that I want to come back to, the idea of these cytokines, is there any reason that you know of or that you can think of why these would exist from like an evolutionary perspective in this way? It sounds like they're just kind of like causing pain and storing, for lack of a better word, trauma in places and causing a negative reaction, but not necessarily from like a protective standpoint. At least it sounds like to me. But is there any evolutionary reason that you can think of as to like why this would this be advantageous?
Well, I'm not an evolutionist or neurobiologist. However, I believe that this arrangement is ideal for survival because, first of all, to respond to a threat, we have to engage our body, in that fight or flight response. Well, activating myofibroblasts is another that allows a longer term contraction pattern to occur than just what's happening neurologically from our brain. And so it's just another layer of stability, activity to fight or flight, right? So I think the problem is, evolutionarily, we're now living at twice the lifespan than we used to, right? And we have different types of ongoing stressors in our life that are prolonged rather than a one-off kind of thing. And
Right.
so the cytokine release has not adapted to how our lifestyle has evolved. It's just, stayed what it was originally designed to do, I believe.
Right. No, that makes sense to me. I mean, it seems plausible. And I wasn't asking for a specific answer, but just your ideas, because you think like this doesn't seem like it helps us really in any way. But if you can imagine, needing to fight a tiger, like, yeah, you would want to be like a little bit tight, a little bit locked in, a little bit more stable, so you have access to like as much strength and power output as possible to like defend yourself or do whatever. But we have no or very, very, very few real immediate threats and stressors in our life other than like, your boss is annoying you and that's happening 24/7, but that's causing inadvertently or in conjunction with other things like your back pain. Like it doesn't help us in our life today, but there is a reason why it would have been that way.
Yeah, well, reflex responses occur without the brain activating those muscles. That's the beauty. So they occur faster than our brain can make that muscle contract. So the brain is notified concurrently while the reflex is happening, but it's not causing your thigh muscle to contract. That's a loop that's going through your spinal cord and then coming right back to your muscle immediately without the brain. And so in times of stress or, fight or flight situations, you need those quick kind of response, activities to respond to those threats, right? So you can't rely on your brain to try and figure out what's going on here and figure out, you just got to throw up that hand and block whatever's coming your way. And so that's and then also, if you're going to fight off a threat of some sort, you want every tissue in your body geared towards fighting off that threat. And that's where the fascia and myofibroblast contraction may come in too, is that it is contracting alongside all of those reflexively controlled muscles. And then your brain is coming in to try and figure out the whole thing out, after the fact. Right.
So we get the stories of, a mother lifting up a car to pick up a car off her kid or something like that. These crazy kind of things. It's like that would never happen. You asked her to do it again, she couldn't do it again. But in that moment, her body was able to organize itself and like figure it out to get that stuff done. But it was completely unconscious. She just knew like car, baby needs to move. That's it.
Right. Right. Yeah, exactly. Yeah.
The human body is quite amazing like that. I think that this is why we need to understand all of these types of connections and then understand that these things are possible. And then how do we use that like to our advantage? And then how do we use it to make ourselves stop hurting so much? Because that's probably the biggest thing.
You're absolutely right. And it's just an amazing thing that we have here. And hardly any of us ever really think about it. Right. But the fact that, if you cut your skin, it can heal in 7 to 10 days. And if you break a bone, it'll heal in 6 to 8 weeks. And if you tear a muscle, same thing, 2 or 3 months, our bodies have this ability to heal itself. So the presence of chronic pain means that there is some other obstacle occurring that's preventing that healing from occurring. And I'm speaking from a musculoskeletal standpoint. So what the nice thing is that I've discovered in my clinical experience is that if I figure out what that obstacle is and I fix that obstacle, pain will immediately reduce, similar to pulling out a splinter out of your hand. You remove the irritant, and suddenly everything feels much better very rapidly. And this is, we're not taught this in medicine, right? We don't expect that because I believe we don't understand why the pain is happening in the first place. And so all of our attempts are failing because we don't understand how the body is laid out from a movement, fascial, and reflexive standpoint to put stressors to our lumbar spine and pelvic area, which was the center of biomechanical movement in the body. And I really believe that this book is a game changer. I'm really excited about it. But what I'm really excited about is that, the second half is a workbook that people will figure it out. It's not just, theory.
Yeah.
No, we're going to put this into practice, and you're going to discover these things happening in you, and you're going to fix them and see how your pain goes. It's not some esoteric kind of discussion,
Yeah. I mean, I think this discussion has been a good example of that, where we talked about some science things, but also some very simple practical things that you do it right now or over a couple of days, and you're going to start to feel better, notice results, and feel things, because that's what matters. It doesn't matter if you know all the science words if your back still hurts. It matters if you feel better. That's the thing that you're trying to get at. But understanding the background of it, for me, and it depends, maybe different thinkers are different, I've obviously in the field, so of course I understand it a little bit more, but trying to understand the background of, well, why does this work? And it leads or lends to a little bit of authority in it to have some more trust and buy-in. Okay, there's some things that maybe I don't understand all these science words and whatever, but this person seems like they know what they're talking about. Rick sounds like he knows what he's talking about, using a bunch of words that sounds like it all checks out, and I don't understand all of it, but it's good. And then I go and do the practical application of this, and it works. And that's the thing that really moves the needle, because that's what people want, is to get out of pain. They don't really care about the science. It's helpful to know, but they want to get out of pain.
You bring up a really good point. This book, I really tried to walk the line between satisfying medical professionals so they have something to hold on to, because everything is cited. All the research in the book has been cited that prove that the existence of these things. There's no research that shows that the idea of me putting all this together works, because no one's ever done it before. And I'm a clinician. I don't work at a university conducting research. But this has worked for me clinically for the last 15, 20 years now. And so I've tried to satisfy the medical professionals out there to say, look, here's all of these structures. Here's all the research supporting the existence of all of these things. And here's how it all fits together. And then, but I've also tried, that's what I put the take home points at the end of each chapter. Don't get concerned about transforming growth factor beta 1. You don't have to know that.
Yeah.
Just know that there's a type of fascia that contracts all by itself based on stress,
Yeah.
And so I put these little simpler points down there, and then now you can keep all of this kind of in your mind, these simple points, and understand why you're responding to these tests and exercises in the second half of the book. This will help explain why it is the way it is for you.
Right.
And so I'm excited about that.
If anyone's ever been involved in any type of research or just looked into how research is done, you will quickly realize that a research study could never be done to encapsulate all of this. Even if you did work in a university that had unlimited money, it's impossible to be done, because research is really good at isolating a single variable and finding cause and effect for that one thing. But we know very clearly that there is not just one thing that's going to lead to back pain. There are hundreds of things, thousands of things maybe, and they're all interlaid upon each other in various degrees. And there are psychological factors, physical factors, social factors, economic factors. There's so many things that you can never possibly research all of this and say, yep, found it. Here it is. Here's the pill, and pat you on the butt and on your way. It's just never going to happen. And so at some point we have to get away. I think we've gone too far from there's evidence-based this. And I had a lot of gripes with this as I was going through school, and it's maybe something we can talk about after the recording, but it's gone too far in not relying enough on like, hey, I've experienced these things. I've helped people through these anecdotally. Like, this works. We can make these connections and make these logical conclusions, and just try it and see if it works. It's going to cause no harm, and it's going to have a potential massive benefit. So at least give it a shot. But we also do have the evidence to support 99% of it. We just don't have that one piece that links it all together, and it's just never going to happen.
Okay, since you opened that door, I'm going to get on my soapbox for just a couple minutes. I absolutely agree with you. And this is a problem. So recently I tried to submit a blog article to JOSPT, Journal of Sports and Orthopedic Physical Therapy, which is Orthopedic Physical Therapy's, big journal. It's like the New England Journal of Medicine for Physical Therapy. And they rejected my blog article. And their response was, oh, well, you're going in the opposite direction of where physical therapy is trending right now. And they said physical therapy is trending towards cognitive behavioral therapy, which I've never taken a course in cognitive behavioral therapy, but I had to look it up. And it's basically explaining to patients why they're having pain and try to convince them that the pain isn't really happening as bad as you think it is, right? And so I'm just like, what? We're completely moving away from our strengths as physical therapists of understanding all of these structures in the body. And because we haven't figured out what the problem is that's causing back pain, say, we then think, oh, it must be in your head then, patients, because we're experts and you aren't getting better. So it's not our fault. It's your fault. And so this person, the editor of the journal, responded, well, this goes against where physical therapy is going right now. And so if you want to resubmit an article, you need to read our Practice Act and then find out where the holes are in our Practice Act, that where we've gone wrong in physical therapy. And you have to write about where this idea fits in and plugs those holes. And then, oh, by the way, you just have 800 words to do that. And I'm just like, what? Why would I ever do that?
Yeah.
And he even said, you're going to make a lot of physical therapists upset with this information. Oh my gosh, is that where we've gone? The people who are directing the direction of physical therapy are research oriented, and they're not thinking comprehensively about how the body is working. And so I reached out to several other physical therapists, researchers, and they're just like, okay, well, please supply the evidence of your approach. There is no, you can't, like you said, you can't research this.
Yeah.
I can't prove, that this foot pronation is causing that lateral side bending problem in your spine. There's no bit of research that's going to say that. You just have to use your mind and your brain to figure this out, and I've laid it out so simply in this book. So this is what I'm fighting against. And I hate even to say I'm fighting, because I'm not really interested in changing our physical therapy direction. Let them go wherever they want to go. Long ago, I realized I've got to stay focused on helping my patients. And that's why I became a physical therapist, not to change how physical therapy is thought about and researched and all that kind of stuff. My focus has been on people. And that's how I came to all of these conclusions, is by observing my patients and seeing what is working, and then trying to explain why that's working.
Yeah, that is the only thing that matters. And it's sad to hear this story, because science is supposed to be about finding the truth, not trying to prove your opinions. Like, that's the opposite of what it is. Like, you can, like you said earlier, you can find a study to prove or disprove whatever thing that you want, and they'll have equal weighting and all that stuff. That doesn't necessarily make it true or untrue. And it doesn't make it true, or like it might be true for me and untrue for you. Like, we might have different reasons why we both have back pain, or whatever the thing is.
Yeah.
And so it's about finding what is real, not about trying to prove one's idea or a group's idea, which is it's sad. It's sad to hear.
Yeah. It is. It's sad if I cared more about where our profession was going as a direction.
Exactly.
Right? But as a practitioner whose focus is my patients, it's exciting. I've got a whole new set of tools I can use that I know helps people fast. And if you look at it from that side, that way, then it's an incredibly exciting thing that's happening right now with, I believe, and I don't like the hubris that's, but I really think this is a huge game changer for a lot of people and medicine in general and understanding the human body in terms of back and sciatic pain.
I agree. And that's why, I was happy to have you back on, that this book is coming out, and that I'm thankful for people like you who are doing this kind of work. And maybe taking a risk is too strong of a phrase, but like going against the grain somewhat of the colleagues and the powers that to be in the field, because it's not always an easy thing to do, but you believe it is the right thing to do, and that it is helping, and you're coming at this from a good place with high intentions to help people, and that is really the most important thing.
Yeah. In my experience, I know it's true. So
there you go.
Yeah.
Rick, when will the book be available that people can pick it up?
The book is scheduled to be released on November 11th, and that'll be on Amazon. It's called Pain Patterns: Why You Are in Pain and How to Stop It. And the other nice thing is it's my only full color illustrated book. So it's got great illustrations that show all of these things. I'm not just using words, plenty of pictures to show exactly what I'm talking about. And there are videos to all of the tests and exercises found in the books to help people do them correctly, so they get a clear understanding of what's going on with their body.
Amazing. That'll certainly be very helpful. So November 11th, the book will be available on Amazon. I will have the link to that in the show notes here, and this episode will be out a couple of days probably before the book is released, but we'll put it out there for everyone. Rick, is there anything else that you wanted to chat about before we close off here?
No, my general most people with chronic back pain or sciatic pain or whatever have almost given up on themselves and feel that they're broken. And I want them to understand that they're not broken. They just haven't had the right information yet. And I believe that this information will point you in a completely new direction than you've ever traveled before. And I think you'll be very happy about it.
Very good. Great message. Rick, thank you so much for your time and for coming on again and sharing with us. Everybody, November 11th, Rick's new book, Pain Patterns, will be available on Amazon. The link will be in the show notes for you to grab it. Rick, what is your contact information as well? What's your social media handles, and where can people, website, all that stuff?
Gosh, I'm so old-fashioned, Daniel. You can email me at support@rickolderman.com, and I've got a website, rickolderman.com, where I have all of my books. This is my 9th book I've written. And I've also developed home programs to help people solve their pain that they can, purchase and solve their pain at home using these principles. And then I've also created a practitioner's training program, which this book comes from. It was based on a 10-page neurophysiology paper I wrote maybe a decade ago. And I thought, you know what? I'm going to expand that neurophysiology paper a little bit. And I thought maybe I'll make it into a little booklet. And it just kept growing and growing and growing. I'm just like, oh my gosh, this is a whole book.
There you go. Sometimes that's where the best stuff comes, right? It's just a small idea that just kind of takes on a life of its own, right?
Yeah.
Very good. So rickolderman.com. And again, all the links and everything will be in the show notes. Rick, thank you very much. I appreciate you. Guys, please pick up the book, and especially if you have pain or have been in pain or know someone who's been in pain, because it's going to be something that is going to help them. So give it a look. Make sure you're following Rick on all the places. Give the episode a rating and review and 5 stars, all those good things. It helps the message grow, helps the message spread, and helps the show grow as well. That's it. Appreciate each and every one of you. Go outside, be a good person. See you next time.